This is kind of a summary of what I did using my back of the envelope award. So the project I'm working on is, can social media inform COVID-19 surveillance? Evidence from Twitter. So the outline, so I think this is like around 10 to 15 minutes presentation. So I will go over quickly the original proposal, a little bit of background, especially about what Twitter is and the data we downloaded, some preliminary results, and a little bit of the work that had been going on based off this project. So the original proposal I had, the motivation for it is right at the beginning. So I guess it's almost like a year ago. So social media has this really huge advantage that it provides real-time data that could serve as a very valuable trend tracking tool during a pandemic, where the traditional methods of survey, for example, might take much longer. So the research question that I proposed for this is whether increases in Twitter posts can predict increases in cumulative incidence of COVID-19 cases across 50 US states. So we're looking at a state level analysis using Twitter data. So the data source, there are a few different data sources. So the main one is Twitter. So I assume everyone probably knows what Twitter is, but just kind of like a quick introduction. So Twitter is an online social media platform where individuals and business accounts send and receive short posts called tweets. So each tweet is restricted to 280 characters. And Twitter right now has approximately 152 million daily active users. And then 22% of all American adults use Twitter, especially in the past few years. I think it has been extremely popular. And another source of data we use is to look at state level variables, including average age, gender, race, education level, income, number of hospital beds, and physicians. So these data were obtained from the American Community Survey, the ACS, or the American Hospital Association annual survey. And a little bit of background. So we probably all knew that internet and social media have been extremely popular in the US. So just to give you an idea of how popular they are, so the blue curve here is looking at the prevalence of daily internet use, and the orange curve is looking at daily social media use. So in 2019, we have almost 90% of all US adults use internet on a daily basis, and 72% use at least one social media site. So Twitter is one of the social media sites. A few other that are really popular, like for example, Facebook, Instagram, which is more popular among kids. Yeah. And then here is a quick summary of some Twitter terminology. So I just want to draw your attention to the first two. So tweet is the term that people use for a post on Twitter. So it's called a tweet. So what you can do is you can write text in the tweet, or you can add hashtags, links, photos, as well as videos. And there's another term called retweet, which is a tweet that is forwarded to your followers. So this is similar if you use Facebook. So this is similar to like a like function on Facebook. And then there are some other terms if you're interested in, feel free to read them. I'll just quickly go over the. And then here is just to give you an idea of how much data we have. So this is COVID-19 related data amount on Twitter from the beginning of March till kind of mid-May. So if you so these are the y-axis or the number of tweets. So if you look at this is a huge amount of data that's available there online. Just looking at the first week of March, if we include all the tweets, including retweets, we have over 5 million tweets just in that week posted online that's related to COVID-19. And this number increased till like mid-March, but it has kind of remained well above 5 million through this entire period. So this is kind of the advantage of social media data, is you have a huge amount of data. However, there are some data quality issues, which I will talk about a bit later. So just a bit more about Twitter data. So another important information that we needed from Twitter data is the geographic information. So Twitter used to have geotag for tweets, which is really accurate data via latitude and longitude information. But this function was disabled in 2019 due to privacy concerns. Like Twitter users complained, as well as not that many people were using it. So this was disabled in 2019. So what we used right now is we input geographic information using self-reported profile location, which was voluntarily provided when creating a new Twitter account. And this location on the profile can be modified later as well. But because this is self-reported, the accuracy or the quality of this data is slightly problematic or not as accurate as what it used to be with geotag information. So how did we download the data? So we used Meltwater, which is right now available at UAB through Lister Hill. I think everyone could access it. So we downloaded tweets from all 50 US states using a list of keywords related to COVID-19. So a few examples of these keywords include COVID-19, coronavirus, hashtag COVID-19, and hashtag corona alert. And the two search periods that we did, the first period is kind of pre-pandemic, is from January 21st to January 27 last year. This is the week before the first case was identified in Washington state. And the second period is kind of the initial pandemic period. So the first week of March last year, so from March 1st to March 7th. So we picked this period to capture the initial response and awareness of COVID-19. And so the measure we used in the study, so we constructed two different measures based on previous literature and also our needs for the analysis. The first one is called prevalence of tweets. It is calculated as the prevalence of COVID-19 tweets per 10,000 population per day at the state level. So how we calculated this is we looked for the total number of COVID-19 tweets in a state, and divided by the state population times the days of tweet collection. And because this is per 10,000 population, we also multiply it with 10,000. So this is the prevalence of tweets. And we also came up with this measure called the ratio of tweet increase. So this is calculated as the prevalence, as a ratio of the prevalence of tweets in the first period and the second period, just to capture how much increase there were in COVID-19 related tweets at a state level. And I'm going to show you some figures. Okay, so this figure right here is looking at changes in COVID-19 tweets per 10,000 population per day from 12 states with the highest cumulative incidence of COVID-19 on March 21st. But the order here is alphabetical at the state level. So the hollow circles that you see at the bottom of this figure reflect the tweet prevalence in late January, and the solid circles are what the tweet prevalence is in March. So what we see in general is that there is a huge increase across all the states in COVID-19 tweets prevalence from January till March. And for places like Washington and New York, which was kind of the initial outbreak locations in the US, you see the biggest increase in prevalence. And another set of data here is to just look at what is the kind of raw unadjusted correlation between cumulative incidence of reported COVID-19 cases per 10,000 population and state level ratio of tweet increase. So here this figure is plotting all 50 states, and the y-axis is cumulative incidence of 10,000 populations, and the x-axis is the ratio of tweet increase. So that we can see the ratio is between 4 and 12. So this means there is a 400 to 1,200% increase in the number of tweets or tweet prevalence. And there is a significant positive correlation between these two variables. So what does that mean? We also did a quick statistical kind of a regression analysis controlling for the set of state level variables that I briefly talk about. For example, we control for the percentage of adult population in a state, the percentage of female, percentage of African Americans, as well as education and per capita income. And also medical resources, for example, number of hospital beds per 1,000 population and number of physicians per 10,000 population, for 1,000 population. So the key variable we're interested in here is this Twitter utilization, right? Especially the ratio of tweet increase over time. So what we found is this variable is significantly, well, there's a significant positive association between this variable and the log cumulative incidence. So the interpretation is as follows. Given a 1 unit increase in the ratio of tweet increase, we expect to observe a 26% increase in the cumulative incidence because we use a log outcome. So this kind of verifies what we were trying to look for. There is a positive association between these two. And then to some extent that monitoring Twitter posts could give us an idea of the spread of coronavirus. So this is kind of a summary of my back of the envelope award. And based on this project, I also work with some other colleagues here at UAB. And then there were 2 other kind of projects that we finished. The first one is we submitted another paper looking at vaccine hesitancy and anti-COVID-19 vaccine sentiments online, also using Twitter data. And another project I finished last year is we also submitted an R21 titled Analyzing COVID-19 Conversation on Social Media, a Twitter data analysis to NIH, where we propose to mine social media data to examine public opinion and perceptions. So the proposal was scored but not funded. So working on a revise and resubmission right now. So this is my quick, I think I might also kind of approaching the time limit. Yeah, so this is kind of a summary of my project.